Yes, good evening. So thank you so much for joining, and very warm welcome to our class. So my name is Podkap, and I'm a medical lab scientist and a specialist in hematology and blood transfusion. So I'm the one who will be guiding you through and taking you through this course, blood banking. As you know, we have around 7 courses that we have to take in the ASCPi exams. So this blood banking is going to be the first on the list, and we will take the blood bank course for 2 weeks or 14 days. Then we will continue with the next course. I would like to congratulate you, especially those who have just joined, because you know our course is a cycle, and we admit new members as we start a new course, so that we can start together as the cycle continues. And you know that some of our members have already completed hematology, and they will not join this course because they are now revising for their exams. That's why you find the members of the class. In most cases, of course, you find that we are many in class, but we are in different groups. We have those ones who have just joined. We have those ones who have completed their courses and they are just reading on their own. We have those ones who are doing exams very soon. Maybe they are also undertaking the mock test. And then we have also those ones who have already passed the exams, and they are in a separate group that is known as alumni group of the Trump class. So you have really made a very important choice in your life to transform your career and your future, especially that you are here to prepare for the exam, the international exam, which is not just an exam, but it's about opening doors to international opportunities, to migration, and also to professional recognition that goes beyond borders. You know, different countries accept ASCPi as a primary licensing qualification or certificate, but some other countries they may not do it, but they really recognize ASCPi as an advantage, as you have it, as you're applying for work, as you're applying for visa. That one will also be variable in your application process. In fact, in Trump class, we are not only offering the ASCPi. You know, we are also offering other courses. But ASCPi has been it is the oldest. It is the oldest course we are offering in Trump class. The oldest now. We are offering this course for around 4 years now. Some other courses are quite new, like NCLEX for nurses, which is quite new for almost 1 year, as well as English proficiency training, which is almost all 1 year old in our programs. We have also continuing professional development programs. These are what you call CPD programs. That's for Rwanda Allied Health Professionals Council. And this one has also been old for 3 years now, or 2 to 3 years. So having said that, ASCPi is the oldest program we are offering. So which means being oldest, which means that we also have acquired extensive experience in this program. We have already graduated hundreds of alumni, not tens, but hundreds of alumni already graduated. All of them passed the exams, of course. We have those ones who are already pursuing their careers in the US. Others are pursuing their careers in other countries. Others are using this opportunity, this certificate to yes, I will answer that question, Mr. Bright. You're asking about English exams. For English exams, we have also graduated some of them. so far, but English is not a part of this. English is a separate program because we have a separate group of students. We have separate tutors who are also teaching in English program, and we have different admission criteria and admission dates. Yeah, currently we have been admitting for ASCPi, which we are starting today, a new starting cycle. But we are also admitting for English proficiency. In this week, we are supposed to start next week, as well as NCLEX also. That's supposed to start next week. Yes. All right. So so all of the programs that we are offering are being delivered online with the live interactive classes, recorded lectures. We record every lecture we do. It is recorded across all the programs we are offering. Every lecture is being recorded so that you don't miss any program. You don't miss any class session. If you're not able to attend class, you're not supposed to miss a class. You're supposed to have a chance to sit down and take your pen and your notebook and watch what we are teaching, summarize what we are talking about, and then that can help you also to read. I have seen this one that many of our professionals are not actually attending classes. Many of them are attending occasionally, but they are also benefiting from our recorded lectures because it is really helping them so much. Though attending class, of course, is a good thing, but even if you don't make it to class, I know that all of us are working, and of course you are able to pay off for all these processes because you're working. So you cannot stop work because you are studying. Sometimes you have also family responsibilities apart from work. So that makes it perfect to use even recorded classes. As long as you are somewhere seated in a comfortable area, you can use these recorded classes and be able to take notes and also use them to revise. So someone, please, can you share how to navigate the website? I couldn't find the lecture we did yesterday. Oh, were you there yesterday? All right, yeah. For the new members of class, I'm sorry for that. I was not able to open courses for you because today I was admitting new members. You have seen that we have already admitted number of new members. We are also still admitting others. I have other members on the waiting list who are being admitted after this class. So I was not able because of dealing with the conversations. You know, all of you know how difficult it is, like, of course, to chat on WhatsApp and respond to questions you're asking. And all of you, I know that you have asked me questions, and I don't know if I was able to answer them properly, but I know that all of you asked me questions. So everyone who is coming in, they first of all ask me questions, and I'm ready to respond to the questions as much as I can. Yeah, that's why sometimes it becomes difficult to manage everything, but I try my best. I'm going to open for you the courses after this class. It will not take a long time. Just within 30 minutes, everyone will have access to courses. Okay, so apart from that, we have also what is known as the mock test. Mock test is very important. Mock test is very important because mock test will give us a picture of how you are doing, if you are ready for exam or not. Because the way we structured our mock test, it is structured like exam style. It is exam style mock test, which we use to know whether you are ready for the exam or if you're not ready for the exam, because we use our website to grade your performance, and you can know where you have weaknesses, and we advise you to address the weaknesses before you can go for the exam. So, and that is done at least 1 month before exam. So there's no, you don't need to request for the mock test before you get exam dates, because that is meant, it is used to assess someone who have finished to read and completed everything, but maybe they need our recommendations, they need our inputs in order maybe to address some comments and the improvement areas. So in fact, that's how we use our mock test. And you have to read first, and then you we give you the mock test and you do it. And after mock test, what we do, we advise you to find some time for personalized coaching. That's what we do. We ask you to find some time to do personalized coaching. So which means you are going to schedule a meeting or a Zoom or Google Meet, and we take you through some of those areas. We explain some comments, somewhere you have challenges. We explain maybe for 2 days. 2 days can be enough to address some areas of where you are finding difficulties. So that is the importance of mock tests. Without mock tests, we cannot know where to help you, and it is in fact personalized coaching will be impossible when you do not do the mock test. So another thing that you have to do also, we do for our members of class. Sorry, I don't usually feel comfortable to call them students. Yeah, because no one of you is a student, right? Every one of you is a professional, like me. Huh? So I'm not going to say students. I have students at university where I teach, but you are not students, but you are candidates for this exam. So we also help you in the application and eligibility support. This is given to you for free of charge. We don't charge you, and no one is going to charge you any money for examination application support. How to create accounts, how to submit documents, which documents should be submitted, which way to be requested, where do I request them, how to pay, how to pay everything. So we give that support because we know that sometimes when you make a mistake or when you apply through a wrong route, that's going to affect you because you are going to pay twice. Because when you don't use the right route to apply, you will be paying twice because you'll be given rejection, you'll not be eligible, and if you're not eligible, you have to apply again, which also costs money because you cannot know that you are eligible before you submit and pay money. So that is the thing, and also, of course, we are giving all-round supports in order to assist your process and in order to make sure that you're comfortable. Yes, we are doing our best. I cannot say that you are doing 100% of what is about to be done, but we are really doing the best of ours in order to make sure that your learning is smooth as we want, and is going to be productive. So, in fact, as you know, that probably sometimes we talk about the ASCPi, but maybe not all of you understand very well what is ASCPi. But ASCPi stands for the American Society for Clinical Pathology International Certification. This is a very, very respected credential in medical lab profession and also clinical pathologists and others. And with this ASCPi, you automatically hold the equivalence of United States license to work in as a medical lab scientist, as medical lab technologist, as medical lab professional. And even though you are not trained in the USA, now you have equivalence to work. Not all the states. We have around 5 to 6 states where you need to also take what you call state licensure, but this is the starting point that you need to take before you can apply for any work in the US. And other countries also recognize this and give it values, including Canada, Australia, and Gulf countries, because from what we have from there is that many countries from there, many countries are American countries. I mean, many hospitals are American hospitals, and they prefer this ASCPi as a recognized credential to apply for work, even though you may have like national licensing bodies. This is very well recognized in different countries. Yeah, so the exam, where are you going to take the exam? Maybe you have been wondering how and where you are going to write your exam. So we have exam center in most of countries, even including your country. If you are from Kenya, we have centers from we have one center from Nairobi, another center is in Mombasa. If you are in Ghana, we have a center in Kumasi, we have a center in Accra, the same as Nigeria as well. We have centers, and also Cameroon, we have centers in Uganda. We have centers in Zambia. We have centers in South Africa. We have almost in every English-speaking country, we have a Pearson Review Center where you write your exam. You don't need to travel abroad for the exam, and you have to do exam. It is supposed to be a computer-based exam with 100 questions, multiple choice questions. And some of you have been asking me, how about practicals? We don't do practicals, but we teach in a practical way. You will see, or some of our class members who have been here for some time, they know we teach in a practical way. You understand what's supposed to be done practically when you learn and read what you are teaching. So, and also ASCPi is like that. The spirit of teaching that we have is from ASCPi. The way ASCPi exam is structured is what dictates us the way of teaching. So we don't just teach, we don't just take anything. That's why we advise you not to spend your time reading many other things. That will be very useless. So what you do, focus on what you have, because we are improving. Always, every day we are improving. And we are improving, we may improve faster than you can read. We may be able to read, we may be able to read for, we may be able to read the content of the book. Yes, because, excuse me, sorry. Yes, we may be able to read the books before you can, because we are always reading the books, we're always finding new information, we're always using recommended textbooks in order to get information or what we can improve, what we can add. We are always using the exam style, which is updated, which is recent, in order to know which area that should be added or which area should be improved in our content. So that's why we say we are just here for you to make sure that we have everything now on board. So as you are with us, use what we have. That will be very, very enough for the exam. Okay, so we have exam in seven courses. As you know, we have clinical chemistry, we have hematology, we have immunology, we have microbiology, we have blood banking, we have urinalysis and body fluids, and you have laboratory operations. So those are the 7 courses you do, and we have 100 questions from those questions. Meaning from those courses, from those subjects, and the passing score is 400 out of 999. It's like the scale between 0 to 999. So which means the highest you can get is 999, and the passing score is 400. So, but this is exam, a computer-based exam, and most of the questions are case-based, and the knowledge you have to apply here is problem-solving knowledge to answer questions. Is not like simple recall or simple memory you can use to answer questions. So that's why you have to read enough. You have to read as much as you can, so that you have enough information that will help you to answer questions that involves problem-solving skills. All right. So finally, we have our program now is going to run for 3.5 months, right? 3.5 months, and it is going to be online, fully online, and we'll be having like 1 hour live class every evening from Monday to Thursday. We have also weekend. Sometimes we progress up to Friday and Saturday, sometimes even Sunday. Maybe if we want to finish something, if you want to finish your course and you have a task to finish it within time, sometimes we can take Fridays, we can take Saturdays, sometimes we can take Sunday, but not always, because we also need some time to read. So my advice now, finally, as you are learning, it is very important that you read first, or you read ahead of us as you are teaching. So make sure that you read, even if you don't do it, but make sure that we don't accumulate. Don't accumulate something. Don't accumulate blood banking. If you are doing blood banking, make sure that you don't accumulate it. Make sure that you read it as we try to finish blood banking. It's very important to read enough at speed, so that we don't take another course as you are still reading blood banking, because it's going to disturb you. You can imagine if you are reading blood banking, but in class we are doing chemistry, it's going to be disturbance. So it's very important to try to read at speed that is enough that when we cover this in 2 weeks, make sure you have finished reading everything, and even attempt questions, because we also share with you ASCPi questions that you use as a question samples in order to help you read better as you are doing questions. So someone is asking a question: is the setup of exam same as Media Lab online course? I don't know Media Lab online course because we don't have course in other course. So you will see how questions are set. I will share with you each of you questions, ASCPi questions, and you see the way the questions are set. Yeah, because we may not have like real simulation of exam, but we have also similar simulations of exam in a mock test. When you go through the mock test, you will be able to see the way exam is set. That's the way we also configured our system. The way our system is set is the way exam is set. So it's just computer based. You sit, do, and then after that you submit, and the system will mark you immediately. And at the end of exam, you know the answer. I mean the result, whether you fail, whether you pass. It reflects on the screen as you finish to submit your exam. All right. So thank you very much. I think that's all I would say, and most welcome. Even though we still have some other members who are joining, but I think because we are still agreeing on some terms, they will join tomorrow. But let's now start with the blood banking, and I think I may not be able to hear you if you speak now because I've connected my voice recorder. If you have any question, feel free to type it in the chat box here. I will be able to see it immediately, and when I see it, I will attend to it. Thank you so much. I think we can now proceed with our today's class. Thank you. Okay, so today class, the first one, we are going to start with the donor selection and unit correction. But here we'll discuss mostly about donor selection process. And in this, is the first course, is the first lesson in blood banking. But we have around 4 sections in blood banking. 4 sections. The first one is known as the blood transfusion practice. We will be talking about donor selection, unity correction, component preparation or production. We'll talk about transfusion therapy, transfusion reactions, and also of course, the indication of blood components and storage and transportation and so on. That is in transfusion practice. So the second section will be mostly about blood groups and serology, We'll be talking about all the blood groups, ABO blood groups, rhesus blood groups, Kerry, Duffy, MNS, PIN, and whatever. All of the groups that are clinically significant in blood banking will be discussed in the blood group systems. Apart from that, we also have serology. We also have other serology or molecular studies. We'll be talking about antibody identification, antibody detection or screening process, and also identification of antibodies. We're talking about hemolytic disease of the fetus and newborn and how to dose rhesus immunoglobulin. We'll also be talking about dosage of some transfusion products like factors, factor 8 concentrates, factor 9 concentrates, and the other factors like PCC. Then we'll also be talking about antiglobulin testing, direct and indirect testing. So those are the major areas of blood banking. So now the first we are going to start with the transfusion practice, and the first topic will be donor selection process. So transfusion today is very safe, and is safer than ever, and thanks to the strict FDA and AABB guidelines. FDA is American Food and Drug Administration, and AABB is the American Association of Blood Banks. So these organizations set guidelines that we follow in blood transfusion. So that's why currently in your country, in my country, blood transfusion is safer than ever, because we are referring to the guidelines set by FDA and American Association of Blood Banks. Across all blood banks globally, most of them are referring to the guidelines set by the American Association of Blood Banks and Food and Drug Administration. So this lesson is going to cover donor history, physical examination, testing requirements, allogeneic and autologous and apheresis donors. FDA and the AABB sets national guidelines for donor selection and serologic testing in all the United States blood bank centers or blood centers. But of course, as I said, in different other countries, we are referring to the AABB and FDA guidelines. So the College of American Pathologists also inspects and accredits compliant laboratories, including transfusion services. So the American Association of Blood Banks, or CAP, dissimilar like the Joint Commission also and the COLA, they accredit. These are known as accrediting organizations. They accredit compliant laboratories. Of course, even transfusion service is also accredited. So registration now, when you are registering or donor registration, the following details are recorded by correcting facility during donor registration. This is what you call correction and the mobilization of donors. This include name, first, last, and middle name if applies, and the date and time of donation, address, telephone, and gender, and self-identified, including transgender donors. When it comes to gender, it must be a self-identified gender. So it is not be assumed that you are going to look at a person and you say this person is a man or this person is a female. So you have to respect also the fact that there are also transgender donors who may be self-identified otherwise. Age or date of birth. So the minimum age is should be at least from 16 and above, and this is state dependent, because some states in the US sometimes they prefer from 17 and above, but minimum is 16. This actually apply for allogenic donors, and no upper limits for these allogenic donors. And I don't know if you understand the term allogenic. Allogenic donor is a donor who donates blood for someone else's use. That person is called allogenic donors. Whereas autologous donors is a person who donates blood for their own self-use. Like myself, I can donate blood, which would be supposed to be stored in blood bank, as I'm waiting for a certain operation. And when the operation is done, they will maybe transfuse back my own blood, a part of it or the whole of it. So for autologous donors, there is no age restriction. It can be 15 years, it can be 12 years. It is possible for them to donate blood autologously, though this must be evaluated by the medical director of the blood bank, or blood transfusion facility medical director must be the one who evaluates the possibility of autologous donation of this young child, maybe 15 years, 12 years of age. So some additional information that can be added during the donor registration, if applicable, patient name can be added for directed donation. This is patient name, which means that when you give what is we call directed donation, it means you are donating blood for someone else use, but the person is known. You can say, I'm going to donate blood for my child, for my parent, for my friend, and that's what you call directed donation. And because that is directed donation, we have to include patient name for which this blood is indicated or directed to, and the rest it must be also indicated in some cases. Because why do we need to indicate race? Why do we need to indicate black or white or Hispanic or Caucasian or Latina or Asian or African? Why do we need to indicate that? It's because when you are studying some phenotypes, for example, in terms of blood groups, some blood groups are prevalent in one race, but not the other. And some antibodies are also prevalent in one race, but not the other. We will see when you are studying blood group systems. So that's why sometimes when you are looking for a certain blood group for which you don't have enough blood in storage, maybe you want to transfuse a certain blood to the patient with the multiple antibodies. So you can say, okay, let me go to look for this blood in a certain race because they have in their prevalence, their antigen prevalence is low. So that can be very useful as you are struggling to find a compatible blood for the patient. So apart from donor registration, we have also a way to do deferrals. Donor deferrals refer to the situation where a person is temporarily or permanently not allowed to donate blood because they don't meet certain health, safety, and eligibility criteria. Very important points. In fact, because not everyone is eligible to donate blood. That one we agree. And how do we know that this person is not eligible for donating blood? How do we know it? So we know it through deferral protocols. So there are three types of deferrals. We have temporal, we have the indefinite, and we have permanent deferrals. So temporal deferrals means the prospective donor or the potential donor is not able to donate blood for a limited period of time. It can be in months, can be in weeks, can be in days, can be in years, but this is a limited period of time. We have also the second category of deferral, which is indefinite deferrals. Indefinite deferrals means that the prospective donor is not able to donate blood for someone else for an unspecified period of time due to current regulatory requirements until changed. So it means that there are some regulatory requirements that don't allow this person to donate blood until these requirements change. And this is sometimes that there might be something that is suspicious of compromising the blood components that we need to transfer to the patient. Maybe that is not like permanent, but we don't know when this can change. That is what we call indefinite. So the time we can give the patient is not known until current regulation or regulatory requirements change. So we have also permanent deferrals, which is of course the prospective donor will never be eligible to donate blood for someone else. That is for permanent deferrals. Now let's look at some examples of each of these deferrals. Example of temporal deferrals include patient, not patients, but you can call patient donor. A donor on antibiotics. If a donor is taking antibiotics, the deferral is temporal until treatment is complete and infection is resolved. That is when you can donate blood. When you are taking antibiotics, of course, there's no time because we just want to wait for you until you complete your medication and infection is resolved. So which means taking antibiotics must be one of the questions that is present on the questionnaire, which is filled by these prospective donor. We have to include also antibiotic taking. Secondly, the donor can be taking aspirin. Aspirin use for the donor. This donor should be deferred for 48 hours. If the donor is supposed to donate platelets, it can be platelets apheresis. It can be platelets which is collected from whole blood. That's any way of platelet collection. Of course, 48 hours is there for deferral time for this person to donate blood, because aspirin can impair platelet function, can impair platelet hemostasis. Hemostatic activity of platelet can be impaired by aspirin. So we don't use this particular platelet, even though there is no restriction for whole blood. But if platelets are going to be taken, are going to be extracted from whole blood of this person, we should not use them as a sole source of platelets for the patient. We can use them, but we know that they are not actually going to be functional, fully functional. So we have also to make sure that we give the patient another unit of platelets that is not from the same donor. So what about pregnancy? Pregnancy deferral period is 6 weeks. And 6 weeks after delivery or after normal delivery or after termination of pregnancy, exception can be made for autologous donation if complications are expected. Sometimes you may have some exceptions in case of autologous donation. Sometimes we may differ or not, but you have to evaluate possibility of complications after that, because this person has been pregnant. So we have to be careful to take blood from her, even if there's no deferral for autologous donation, as long as this person meets physical examination fitness. But we have also to evaluate if any complication is expected, and then you can set time for deferral for this person for autologous units. So abortion or miscarriage before the end of second trimester is not the cause of deferral. This one should be understood, because when the person has had abortion or miscarriage, but before the end of second trimester, so there's no need of deferral. They can donate blood anytime. 12-month deferral is always expected if the woman received a transfusion during her pregnancy. If this woman received any blood units during her pregnancy, 12-month deferral is anticipated for this mother. So other temporal deferral include post-donations. We have to defer for 16 weeks after double RBC apheresis. You know what is called apheresis. Apheresis is done by machine. It takes blood, a component that you selected, and it returns back the rest of blood. If you are doing a double, what the meaning of double apheresis and what the meaning of single RBC apheresis? So depending on your hemoglobin concentration and also your fitness, you can donate double RBC units, which means 2 units or even triple. Sometimes we call it triple RBC apheresis. You can donate like 3 bags of RBC or 2 bags of RBC, depending on your hemoglobin. Okay, so when you donate double apheresis for RBC, it should be 16 weeks of deferral so that you can donate again. If it is single units, of course, it's going to be 8 weeks, the same as whole blood. If it is 1 unit of whole blood, it should also be 8 weeks. So 4 weeks after infrequent plasma apheresis. For this person who are donating plasma, but they are known as infrequent, which means they don't donate regularly, so they have to be given 4 weeks as well. 48 hours, this is for platelets, for leukocytes, apheresis, even for what you call serial serial plasma donation. They are also given 48 hours to donate again plasma, platelets, leukocytes, or even granulocytes. So vaccine, in the case of vaccine, is a bit complicated because we have to understand which vaccine is given. For vaccines that are live attenuated or bacterial vaccines, 2 weeks deferral is expected. For example, measles, mumps, oral polio, typhoids, or yellow fever. Yellow fever is also 2 weeks deferral. Vaccines, including those ones that are for rubella and chickenpox, this should be 4 weeks deferral, and no deferral for killed synthetic or toxicoid vaccines. For example, most of current vaccines are synthetic, others are toxicoids, others are killed, but even killed, they are no longer used. Whatever we have now is just synthetic. We can take maybe a part of protein, a part of DNA, a part of RNA, and we use it, or a part of a cell wall, a part of something. We can use it as even membrane proteins can be used as vaccine. So, for example, hepatitis B, influenza, tetanus, there's no deferral. But if the donor is healthy, smallpox deferral is 14 to 21 days. So, apart from vaccines, what about transfusion? So, transfusion or graft. Graft is a transplantation. Transfusion or transplantation, we have to give also 12-month deferral after receiving any blood or tissue transplant. So blood contact or needle exposure, for example, someone who did tattoo or body piercing without any doctor consultation. So this person is given 12-month deferral as well, unless performed by a state-regulated facility with sterile equipment. So this must be documented. If you did a tattoo, it is not bad. It's not something bad, right? Tattoo is not something bad. You can do it, and it does not mean that you broke any law. But this must be done in a place where safety is the first thing that we respect, especially where the state-regulated facility with all sterility in place. Sexual contact with HIV positive person, of course, this must be also 12-month deferral. Sex with a prostitute, 12-month deferral. Sex with the injection drug users or people who are using hemophiliac, who are hemophiliac and they are using clotting factors, that should also be 12-month deferrals. So this means any possible contact with the blood must be 12-month deferral. Blood or body fluid, or any way someone can be suspected to have contracted infection, that also 12-month deferral. So male to male sexual contact, 12-month deferral. Sexual contact, female sexual contact with a male who has had male to male sex, that would also 12-month deferral. That is like a woman or a female person who had sex with homosexual men. This would be 12-month deferral. Close contact with the sexual exposure to hepatitis patient, sexual exposure or even close contact, maybe staying together. It should be 12-month deferral after the end of contact. History of syphilis or gonorrhea, it must be 12-month deferral after completing treatment, because these things, they are recurrent. We don't trust them. You have to give them 12-month deferral. If someone was on treatment of gonorrhea or syphilis. Any way of incarceration, which is a prison, detention, lockup, or juvenile detention, this is also 12-month deferral from the release of prison, because of course, in the prison we suspect there is activities of homosexuality. There also a problem of maybe being in close contacts with people. So that is also to be 12-month deferral from someone released from incarceration. For malaria case, this is for United States regulation, but not in every country, because every country identify their own way of dealing with malaria. But in the United States, it must be 3 years deferral after recovering from malaria, or if the person was in resident in endemic area of malaria, at least 5 years. This person is given 3 months, 3 years deferral. But 12-month deferral after a short-term travel to endemic regions. Like, for example, you are from the US, you are traveling to Africa. Most African countries are endemic regions of malaria, and that is a 12-month deferral. Leishmaniasis is also 12-month deferral after leaving endemic area of Leishmania. So now, then we have indefinite deferrals. Indefinite deferrals is, you remember, is the deferral reason or deferral criteria that is imposed until regulatory requirements change. And this is for HIV person, which is indefinite deferral. And don't ask me why not permanent deferral, because I've been receiving questions asking me why is it not permanent deferral. But this is regulation of American Association of Blood Banks. So it is indefinite deferral. So don't be confused when you are given this one in the exam. Don't choose permanent deferral, even if it is HIV. Use needles for drugs, indefinite deferral, using clotting factors concentrate. For example, someone who have been using clotting factor concentrate, like factor 8, for example, for hemophilia A or other hemophilia. This person is also given 12-month deferral. Sometimes, if the person have been just used this person used it once, 12-month deferral. But if the person have been using it, this should be the indefinite deferral. Chagas disease, the same, indefinite. History of cancer, leukemia, and lymphoma are 12 months, and history of bleeding and also blood disorders, for example, hemophilia, von Willebrand factor disease, sickle cell anemia, thalassemia, Kaposi sarcoma, and polycythemia vera. That is always also indefinite deferral. So that means you cannot donate blood when you have like blood disease until that blood disease is cured properly, and that is and which means we cannot give temporal, because we don't know when it will be cured. That's an example of indefinite. We just give them indefinite, and when they are cured and they are eligible now to donate blood, they can donate it in the future. Finally, we have permanent deferrals. So permanent deferrals, we have some conditions like hepatitis B. This is permanent deferral. Viral hepatitis diagnosed at the age of older than 11 years, permanent deferral. But when this hepatitis B was diagnosed before age of 11, this is not permanent deferral. It is given temporal deferral, and you have to check this person. Because as you know, hepatitis B has got what we call permanent phase, chronic phase, and the acute phase. Sometimes acute phase of hepatitis can be cured by the body itself without even treatment. Like a small percentage of hepatitis infections, like 10%, can be cured. So in this case, when the person was diagnosed for hepatitis before 11 years, they are eligible to donate blood at 16 years. So when they come to donate blood at 16 years, they can be tested again, even if they have a record of hepatitis infection in the past. You cannot give them permanent deferral, because sometimes if they don't have infection currently, maybe it was cleared by the body. So what we do, we give them temporal deferral, and then medical director will have to check and review the history and the current results. Maybe they can perform even hepatitis B surface antigen, hepatitis B co-antibodies, DNA, and if they check, if they are negative, then they can go on with the blood donation. So that's the reason why we're going to give them just permanent deferral if it was diagnosed before the age of 11. Another condition which is also permanent deferral is the Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease also is a very serious disorder which affects the brain. It's called brain-eating infection, which of course cause a fatal condition and also affecting the brain badly. It is of course permanent deferral if someone was diagnosed with a Creutzfeldt-Jakob disease in the past, or who received dura mater transplant or pituitary-derived or human growth hormones, because we don't know why they had to transplant dura mater. Maybe it was because of that. So these people have to give them permanent deferral. Indefinite deferral is given to a blood relatives of someone diagnosed with the Creutzfeldt-Jakob disease. We have to give them also indefinite deferral because they are relatives. Maybe we don't know. Maybe they may have contracted this because it is very contagious disease. Finally, we have also what we call xenotransplantation. So xenotransplantation is when you transplant organ or a tissue from a non-human animal. For example, you have heard people maybe saying that they transplant maybe organs like from pigs, from other animals to humans. That's what we call xenotransplantation, and it is permanent deferral if the donor received tissue, cell, or organ from a non-human animal. So that is permanent deferral. All right. So that was the overview of the questionnaire, because we have the questionnaire and we'll check everything. So because we are doing donor selection, and you have to know all the things that can make us differ or stop or accept our donor giving blood. Then finally, we have also to check physical fitness. Physical fitness include weight, temperature, hemoglobin, and also skin region and overall eligibility for physical appearance or fitness. For weight, all donors should weigh at least 111 pounds. That should be 50 kilograms. That is the minimum, with a maximum of 10.5 milliliter of blood per kilogram, which means someone with a 60 kilogram, you can still collect around 600 milliliter of blood, like all blood, if possible. So, and when you, for someone of 45 kilogram, for example, if they are going to give like autologous, you can still accept them, but you have to lower the volume. You have to lower the amount of blood to be taken. So of course you have to consider 10.5 milliliter of blood per kilogram. Okay, that will be a question in the ASCPi exam. I saw it somewhere. They were asking, what do you do if someone is weighing less than 50 kilograms? What will you do? Of course, you have to lower the blood volume. That is a simple thing. Donor temperature should be at least less than or equal to 37.5 degrees. And some people have been making mistakes here. I have seen people making mistakes here. Because sometimes if they give you this question, they can give you 37. Top, they can give you 37.5 and low. So don't be confused. Don't choose 37. Even 37.3, even 37.5 is okay, unless it is greater than 37.5. That's when it is not acceptable. It is not 37.0. 36 is fine. 37 is fine. So temperature less than 30. 37.5 is okay, unless the patient is having like hypotension, which is like less than 35. That cannot also be, that condition can be evaluated first before you collect, because 37.5 less than that is not a good temperature. That is a hypothermia. So hemoglobin should be, women hemoglobin should be 12.5. For men hemoglobin must be 13.0. But if you are asked the question in exam and they don't mention sex, that is going to be, you should choose 12.5 if they don't mention sex. If they say a random person is giving blood, what hemoglobin is that? It must be 12.5, not 13. 13 is only for men. For autologous, however, as they say, autologous is we donate the blood for our own use. Autologous should be at least 11.0 grams per deciliter of hemoglobin. So skin lesion should be if they present, if you see multiple puncture on the skin, maybe arms or wherever, or face, it is a cause of indefinite deferral. Don't take blood if the person is showing multiple punctures marks on the body. It's not safe. Overall eligibility, however, donor must meet all the above physical and laboratory criteria before donation. That is our last statement we can make here in this case of donor selection process. Maybe if you've said something that you did not mention, you can feel free to write it here in the message box and we will answer your question. Or if you have any question, you can write it there and we will answer your question. Otherwise, I really appreciate your attendance. Thank you so much for this first day. I think you have used our time efficiently. We are meeting tomorrow and we proceed with other topics from tomorrow. Thank you so much. If there's any question, feel free to ask.